Good morning, everyone. I'd like to welcome you to our panel discussion on the impact of federal policy changes on social services. My name is Eli Veitzer. I am privileged to serve as CEO of Jewish Family Service LA, and honored to sit with, or to stand with this incredible panel. I imagine that many of you have been following the headlines about the budget and fiscal upheaval in Washington over the past few months. For those of us mucking around in the details, it's a lot worse than the headlines themselves. Many of the cuts will have catastrophic real-world consequences for vulnerable individuals and communities across the country and across California. As our panelists speak about some of these impacts, I want to ask you to please keep in mind that on the other side of these policy changes are people. Real people who don't know what Title V is, or Adult Protective Services, or any of the dozens of programs and departments that are slated to be cut or eliminated. But real people who will now find themselves in more desperate situations without access to the services and supports upon which they've relied in the past. So I'd like to welcome our panel and introduce our panelists. We are still short one. He will hopefully arrive soon, but we'll start here. The Honorable Betty Yee, former California State Controller. Betty Yee was elected State Controller in November 2014, following 2 terms of service on the California Board of Equalization. She was re-elected to a second term as Controller in 2018. For those of you like me who might be asking, well, that sounds very nice, but what exactly does the controller do? I looked it up. So according to Google AI, the source for everything, a state controller is a chief fiscal officer of a state, in this case California, responsible for overseeing the state's finances. They act as the state's accountant, ensuring accountability and disbursement of state funds, and also oversee the state's internal audits. In other words, if you have trouble thinking about balancing your checkbook, imagine being responsible for managing and balancing the state's $322 billion checkbook in real time. So it's a big job. Ms. Yee earned a BA in sociology from the University of California at Berkeley and an MPA from Golden Gate University in San Francisco. She currently serves on the board of directors of SARAS, the College Futures Foundation, and the Asian Pacific American Institute for Congressional Studies. She serves as vice chair of the California Democratic Party, and she is a candidate for governor in 2026. Welcome. Michael Hopkins, currently CEO of Jewish Family Service of San Diego. Since becoming CEO of JFS San Diego in 2012, Michael Hopkins has made an indelible impact on JFS and the San Diego community. Under his leadership, JFS expanded its headquarters, enabling the agency to increase and centralize services. Other notable accomplishments include the creation of the Center for Jewish Care that assists Jewish community members who are experiencing trauma, grief, or financial challenges, facilitating JFS's leadership in the development of the San Diego Rapid Response Network and its migrant shelter services for people seeking asylum, operating 6 safe parking lots in San Diego, Encinitas, and Vista, for people sheltering in their vehicles, and leading the nonprofit through its centennial celebration and campaign to sustain the future of the organization. Prior to JFS, Michael served as executive director of Nehirim, a national Jewish LGBT organization, and CEO of the Jewish Community Center, Metro West New Jersey. In 2024, Michael announced his plans to retire at the end of June 2025. Welcome, Michael. We got you in just under the wire. Robin Mencher is CEO of Jewish Family and Community Services East Bay. Robin Mencher leads JFCS East Bay to envision a community where everyone can flourish with dignity through advocacy and providing comprehensive support services at every stage of life. An educator, her work focused previously on media literacy, youth voice, technology integration, teacher learning, and educational equity. She served as executive director of KQED Education, program director of the San Francisco Education Fund, and taught high school as well. She is a member of the board of the National Association of Media Literacy Education. Robin earned her MA in Education at Mills College and her BA in American Studies at UC Santa Cruz. Welcome, Robin. The Honorable Corey Jackson, Assemblymember and Chair of the Budget Subcommittee on Human Services. Assemblymember Dr. Corey Jackson was elected to the California State Assembly in November 2022 and re-elected in 2024 to represent the 60th Assembly District. He currently chairs the Budget Subcommittee on Human Services. Assemblymember Jackson served on the Riverside County Board of Education in 2020 and represented portions of the cities of Riverside, Moreno Valley, and Paris. He also served as the founder and chief executive officer of SBX Youth and Family Services, whose mission is to break the cycle of poverty and violence through mentoring, education, and community organizing. The organization was instrumental in a historic settlement of a lawsuit against the Youth Accountability Team, a program in Riverside County that treated thousands of youths, particularly youths of color, like criminals for minor adolescent misbehaviors. Dr. Jackson graduated from CSU San Bernardino, where he received his degree in political science and served as a member of the CSU Board of Trustees. He is also a graduate of California Baptist University, where he received his Master's of Social Work degree and a Doctor of Social Work degree. Welcome. So I'm going to start with a question, Ms. Yee, for you. From the moment the president assumed office, there has been an unending onslaught of policy changes and disruptions. For many of us, it's sometimes hard to understand how federal cuts impact local social services. I'm wondering if you could help us, walk us through the flow of federal funding to the state, to municipal governments, and to direct service providers.
Sure, I'd be happy to. First of all, excuse me, good morning, everyone, and I'm really happy to be a part of this esteemed panel. I want to just preface my remarks by saying, and just to punctuate something you said, Eli, and that is everything that we talk about relative to funding, there is a human face at the other end of all of the decisions and deliberations. And I'm just happy to be here with Michael and Robin, and certainly Dr. Jackson, to keep reminding us that when we talk about budget, it really should reflect it should be a statement of our priorities and values. And so I hope we can keep that throughout the theme of this budget season and beyond. So having done state budgets for the better part of my career, federal funds are one of these things where when budgets are good, we don't usually think about them. When they're bad, we rely heavily on them and see how much more we can squeeze. And today, I will say that it's really important to just understand kind of how federal funds work in our state budget. A significant share of California's budget does come from federal funds, and so they come in a number of ways. One is in the form of grants that are made directly to states, and the other way is through trust funds, and these are usually tied with specific conditions. Most of the dollars that we draw down, particularly in the health and social services area, are trust funds. In other words, we have to meet certain criteria before we can actually draw down the federal funds, whether it's a maintenance of effort requirement or our own funding level being fulfilled before we can pull down federal funds as a match. A significant portion of federal funds does come to California as part of our budget. Just about a third of our overall budget is federal funds. So it's a significant percentage. It is includes essentially more than $170 billion. And I remember when the headlines were first surfacing about federal funding cuts, thinking about how the heck are we going to fill a $170 billion hole? And the answer to that really simply is we can't. We can't. With all the tools that we have available to us, we can't. Almost 4 and 5 federal dollars that are projected to flow through California's proposed budget, about $135 billion, support the vital programs that each and every one of you touch every day. And these are in our human services arena, in our healthcare arena, and serve really the most vulnerable of Californians, but really mostly children, seniors, and families with low incomes. The largest share of federal funding is for health and human services programs, about $112 billion. And that's projected, that's budgeted through our Department of Healthcare Services for Medi-Cal. And as we know, that provides healthcare services to more than 14 million Californians, and also Californians with low incomes, people who live with disabilities, children, older adults. And more than half of Californians who are enrolled in Medi-Cal are from our Latino communities. And so I just wanted to kind of paint this picture because I think it just kind of keeps the frame in mind about who's actually affected. The second largest share of federal funding for health and human services programs, about $11.7 billion, goes to the Department of Social Services. And these funds support child welfare services, foster care, the CalWorks program, and other critical services that assist low-income and vulnerable Californians. And then the remaining federal funds that flow through the state budget, about $36 billion or so, support a broad array of public services, including labor and workforce training programs, K-12 education, some for higher education for our community colleges, our UCs and CSU. About $6.7 billion is for our public transportation programs, also for improving our state and local road infrastructure, and about $5 billion for additional public services systems, including for environmental protection, the state's court system, and some funding for our state correctional system. So it's a little bit of a maze, if you will, but really the heavy piece of this that we're all focused on is on the health and human services piece. Federal transfers to state and local governments can also take the form of competitive grants, and that has been under attack with this administration. And through a competitive application process, we also see federal funds that are distributed usually by formula, but also can be considered for award based on things like population size, particular communities that are affected, highway miles driven, so just different criteria for different competitive grant programs. So these are kind of the big building blocks of the federal funding piece for our state budget. But the biggest piece really is that first piece that I alluded to, and certainly as Assemblymember Jackson is going to be tackling this particular year in the health and human services arena.
Thank you. Assemblymember Jackson, you currently chair the Assembly Budget Subcommittee on Human Services. And I'd like to ask you to unpack a bit what happens behind the scenes among legislators in the governor's office. With rapid policy shifts in Washington, can you tell us a bit more about the conversations you were having around protecting California's policy goals?
Well, certainly we are under great pressure in two fronts. Number one, because of the volatility of the stock market and our progressive tax system, we are projected to have to fill anything between a $5 to $20 billion budget deficit. That's not including the federal threats that are coming. And so this is the time of the year where we prepare for the worst. So as budget subcommittee chairs, we all are given a list to start ranking. What are we willing to let go, and what do we need to fight to try to save? A part of that is some programs that were created during the pandemic, which created some great innovative programs. And it turns out when you look at the data, they are producing some very great outcomes, particularly our housing programs. When someone on CalWorks is in danger of falling into homelessness, there's now a housing program to now make sure that they don't fall into homelessness. There's the programs, the same thing for seniors. As you know, the fastest growing population falling into homelessness is our seniors, and so there's a housing program to that. That pandemic money is now officially ending, which means now not only are we trying to preserve what we have ongoing funds for, but also how do we now make sure that we now continue those programs that have great outcomes that we now need to make sure that we can deliver on. What we are seeing from the administration, I also, state preschool is also in my jurisdiction, as well as childcare. And a few things. Number one, on the floor yesterday, we had a resolution to ask Congress to restore the funding for school meals so that schools can continue to purchase locally sourced farming foods to be able to make sure that young people have the meals that they need, not only just for schools, but also for childcare as well. We also know that they are proposing to eliminate $1.8 billion for Head Start. What does that mean? 1.8 billion just for California translates to 55,000 preschool spots. 55,000. When it comes to our social safety net, although the federal funding as a whole accounts for 1/3 of our budget, it counts for over 90% of our social safety net programs. So that means when they eliminate funding for CalFresh, there is no CalFresh anymore. If they eliminate for CalWorks, there is no CalWorks anymore. And especially if they eliminate things in terms of Medicare and Medicaid, those cuts are so huge, there's no way we can prevent that harm. And when we talk about Medicare and Medicaid, we have to understand that it's not just about health care. It's about in-home supportive services. It's about all of the support services for the intellectually and developmentally disability community who receive support for that. It's about the seniors who are going into day centers to receive wraparound programs, so that, of course, the household continue to function and people can go to work, all those type of things. So what we're looking at is two fronts. Number one, our own budget issue that we need to deal with. When we're done with our budget in July, the federal government will not be done with their budget, which means now we are anticipating to come back maybe sometime in December to try to even clean up, if that's even possible, whatever cuts are coming from the federal government. And once that happens, what does that mean? That means city councils are going to be going into emergency session. That means school boards are going to be going into emergency session. That means county supervisors are going to be going into emergency sessions. It's a whole ripple effect that we're talking about here. But at the end of the day, what's most important is this. This does not have to happen. And this is being done. This is being done, and it sounds like I'm making a political statement, but it's fact. They are making these cuts and doing harm to children, seniors, and the poor so that they can give more continued tax breaks for the rich. This is to make rich people richer on the backs of our most vulnerable populations.
Thank you. Michael, I know that JFS San Diego has been at the forefront of immigrant, refugee, and asylum services. Would you please share what happened to your funding and services almost overnight as new policies were implemented in January?
Thanks, Eli. I was just still taking in all that you said, and it's like, it's an important question what happened, but the consequences of all of these changes for those of us that run human service agencies is like, I don't even know how to begin to think about, we do a lot of scenario planning, but what's coming down is almost more scary than what has already happened. But quickly, literally on January 20th, so just context, Jewish Family Service of San Diego for the last 6 years has been operating a migrant shelter, a shelter for folks seeking asylum. We're right at the border. In that time, the numbers are really phenomenal. 250,000 individuals passed through our shelter, received services through our shelter. Some stayed in California, most went all over the United States. But on January 20th, and so everyone we served was through the CB1 app, which was an app where those seeking asylum could actually book a time to cross the border and for their to be interviewed at the border. So literally on the 20th, the app was shut down. There were about 100 people in our shelter that evening. Within 24 hours, as always, we fly people out to their destination, to their sponsors. The shelter was empty. And the shelter was empty for, we obviously knew it was going to be empty for going forward. At that time, there were 110 staff employed. The shelter itself was about a $50 million operation in terms of healthcare, a variety of services, transportation, case management. Working with the state, the Warren Act, we had to notice our staff, had to give them 60 days notice, 2 months pay. And so we Warren Act 110 staff. and the shelter is now closed down. We have begun to shift to doing more, with the help of CDSS, more immigration legal services. But we're a border town, and the geography is not going to change. Mexico is Mexico. San Diego is a border town, and ironically, the founding of our agency over 100 years ago was we welcomed Jews who were stuck at the border, and we've been at the border for the last 100 years. But the impact is greater than just immigration. Many of our Jewish family services here in California and around the country do resettlement work, and so resettlement, just the implications of all of our funding, about 60-70% of our funding comes from government, 15% specifically from the federal government. And so while we've done scenario planning, it is very difficult to kind of plan for the types of changes that could be coming down the pike.
Thank you, Michael. Robin, how has JFCS East Bay been impacted by federal policy and funding cuts, and how has your agency responded?
Thank you, and good morning, everyone. Similar to what Michael described, at JFCS East Bay, we have a variety of service lines. So much of our work has been grounded in our founding, which is being a partner to immigrants and refugees who are coming to our community. And those are the areas where we've seen the most immediate impact. So I'm from the East Bay of the San Francisco Bay Area, and that happens to be the oldest and among the largest Afghan American communities in our country. So after the fall of Kabul, as a result of the U.S. military withdrawal in the summer of 2021, our refugee resettlement services and all of the wraparound services for newcomers in our counties really ballooned to meet what felt like a once-in-a-generation need. Everyone, you may remember, if you were following the story, compared the event to what happened with Vietnam in the 1970s and the resettlement efforts then. And so we grew rapidly to respond to the need, as JFSs and JFCSs across our state and our country are designed to do. With the start of this new administration was a dramatic shift in refugee resettlement policy, and that meant that we saw a dramatic shift right in our home community and at JFCS East Bay. The best intelligence that the sector had going into the start of the new administration was a timeline that we thought meant that we would have more time to transition than we did. And so even though, as Michael noted, scenario planning is part of the work, and we started it in earnest last spring and last summer, we are creating plans for a different reality than what unfolded in the first week in January as refugee admissions were stopped. And people who had their travel arrangements, who were coming, who we were already in the process of resettling, all of that was paused, and they are still where they were. And the folks who had already arrived, who we were in the middle of resettling, there was a stop work order, which translates into a stop funding order for the people who had just arrived in the previous weeks that we had to address. So we did what community-based human service organizations do. We picked up the ball and we found other ways to get the work done in the short run, and we've added our voices to what we know is fair and equitable refugee policy. And at the same time, we've continued to work on those longer-term plans of if we're not going to see a large number of refugees, how will we continue to hold the values and the goals of refugee resettlement front and center? Self-sufficiency and prosperity and strengthening for the whole community through welcoming newcomers with dignity and care. So that means really focusing on the longer-term goals that families have for themselves and our community, and investing in those areas such as workforce development, education, and care for all the different aspects of someone's life. Now, you might realize that this flies in the face of the tremendous budget cuts that our state and our country is facing because of decisions about next year's federal budget and the chipping away of that now. So it's quite complicated. The other piece that I want to highlight is that JFCS East Bay has an immigration law practice in our umbrella of services. And we have seen, obviously, a dramatic increase in requests for services, requests for support. Last year, the federal government opened a new United States Immigration Court in Concord, California, which is in our geographic region. So our offices are within a mile walking distance of that court. And so we are there supporting people who were already in a tenuous position seeking support from us, but now are coming to us in larger numbers with a tremendous amount of fear. And so that means not only are we doing the work that thankfully we are funded by the state to keep doing, but we are working to add increased services for the people who are caught at the center of these policy changes.
Thank you, Robin. Ms. Yee, you know better than most the ins and outs of our state's $320 billion budget. You mentioned before that we can't replace all of the federal dollars. How can the state respond in a fiscally appropriate manner to the potential and pending cuts from the federal government?
Sure. Maybe as a way of context, so as many of you have read, we have ascended to become the fourth largest economy in the world. And that economic power actually puts us also in a position of having the distinction of not being one of the states that has the least dependence on federal funds. And so in the past, we've been able to actually weather cuts in federal funding and still be able to maintain our priorities and values. And it's because of the just the performance of our economy and our output as really an economic powerhouse. I want to go back to something that Assemblymember Jackson said, and that is we have a very, very volatile revenue system here in California, very sensitive to, obviously, the performance of the stock market, and our personal income tax is an carries outsized weight in terms of the proportion it comprises of our general fund, but it really is generated by a very, very small foundation of taxpayers in California. And so that's always been kind of the tenuous, pin on its head in terms of how the budget is situated. I think the way that, and Assemblymember Jackson and his colleagues will have to really come to grips with a couple of different choices. One is, are there other areas of the budget to cut? And this is where prioritization, looking at outcomes of other programs, whether they're actually producing what we have anticipated that they would produce, and if not, is there a way to actually have those services maybe assumed by other programs, or just outright cut the programs? Secondly, looking at, and this is something I hope will be taking some attention, and that is how we deliver services. Oftentimes we don't have the ability to just kind of pull back and to think about, is the way that we're actually delivering services the most effective in terms of reaching the people that Michael and Robin and so many of you serve in our communities. And then thirdly, looking at raising taxes. I will say that the appetite right now for raising taxes is not good. I think everyone is feeling a tremendous amount of angst around their economic uncertainty right now. But we also, not to put another pressure point into the mix, we do have a temporary tax increase that Governor Brown had put into place that will be expiring in 2030. And generally, before those things expire, we do have a plan in terms of how we're going to replace those revenues. And so I'm going to add that into the mix as well. But I think one of the ways that we can think about this is I always like to try to find just some silver lining in terms of all the challenges that we have to face. And I think Assemblymember Jackson referred to this, and that is certainly looking at those programs that have performed well and how we continue to uplift those. How we prioritize in terms of what's important in terms of the role of a state government. I think certainly the health and safety and the well-being of Californians is paramount. Certainly our public education system is paramount. But there are some things that we are just going to have to be able to do without, and those are going to be very, very tough decisions to make. And perhaps that's a conversation that looks at how we can be enhancing our partnership and collaboration with our local partners, with our counties, with our cities, and with so many other local providers. But on this issue of just the magnitude of this problem that we have that is facing us from the federal government, we can't borrow our way out of it, nor can we, I believe, raise enough revenue to really stabilize it. And one of the things that I hope we see in the next administration is an effort to try to stabilize our revenue system. It is really desperately needed. We can't think about having revenues that are maybe here one year and gone in another year, and so sensitive to the state of the economy. And so there are some, certainly tax reform perspectives that I think should be in the mix. This is for longer term, but it is essential. Otherwise, what we're doing is essentially digging ourselves out of the hole for this year to only revisit it when, again, we're subject to such volatility, either politically or economically. So it's going to take some discipline. But I also think that it's going to take both a short-term and a long-term view. And I also believe it's going to compel us to look at how we work better in collaboration, certainly in coordination among our sister agencies and state government, and also different partnerships. I want to just say a little bit about just the state, I hope, leaning into looking at different types of partnerships as we move through this. For many who are really at the forefront of what we are facing with respect to these federal cuts, we understand who is going to be the most severely affected. But I think for those who are actually here in California, doing business here in California, the private sector, I hope that we can really have a robust conversation with them about how they can be part of the solution, how they can help us invest in some of these systemic changes that we need to make, how they can be hopefully partners when we talk about reforming the tax system, where as we continue to drive hopefully business development and growing our economy, that they also understand that they have a big role to play in terms of some of the social and human infrastructure issues that we have here in California.
Thank you very much. Assemblymember Jackson, what are your thoughts? How can the state absorb the federal funding cuts without compromising our values and priorities?
Well, it just depends on how large those cuts are. Remember, California deals with hundreds of billions of dollars, but the federal government deals with trillions of dollars. So the smallest cut that we have received so far in one day has been $1 billion, right? So just remember, this depends on how big, because there is no way the fourth largest economy in the world can subsidize the number one economy in the world. Now, there are still some ways that we need to do some things, because there are a whole number of corporate tax credits that we give out. And some of them have been around for a very long time, which were meant to help create industries. But we just haven't revisited those. So first we have to find out, right, what are some credits that we think that are no longer a priority of the state. And then secondly, then we have to think about not which programs can we cut that won't cause any harm, but to the extent how much harm it causes. So you have to understand the depth of the discussions that we have to have. It's not whether this cut will do harm, but which cut will do the least amount of harm compared to another. And so we have to figure out, what are some programs that, doesn't have to do with the core functions of human existence: food, shelter, education. Now, healthcare, that's so large, we may not be able to fill in those gaps when it comes to healthcare. Because remember, we have almost over 80% of our population now has health care. Most of it is because of the Affordable Care Act. And so if you cut that, that means that it'll have ripple effects, which means more pressures on our emergency rooms, which means if you live in a community that is that has a distressed hospital, chances are that hospital will have to close down because it can't accommodate that much emergency. But I've made it clear in my budget hearings, California can't save you. If the federal government does what it's planning to do, not only planning to do, voting to do, we actually have receipts now, right? They have been voting on this and moving this forward to be able to do so. And so, I mean, to be honest, I don't think there's much that we can do when it comes to that. People will be hurt. I can't tell you which people will be hurt yet, but I can guarantee you people will be hurt. And the ones that are going to feel the majority of the brunt that I see are going to be seniors and children.
Please. Yeah.
So you're hearing from Assemblymember Jackson. It's really going to be really a prioritization of how to inflict the least amount of pain, and that's a very untenable situation to be in. But there are some other policies kind of adjacent to the state budget that I just wanted to raise because, at the same time that we have been a donor state to the U.S. government and getting less back in terms of the taxes that Californians pay, I think part of why I'm so focused on tax reform is, and New Jersey, by the way, is the top state that does not really rely on the federal government for funding to the least amount of degree. But I think this is an exercise also in how do we build our own resilience budgetarily. And so how do we look at really keeping this economy going to where we are generating our own revenue that cannot be touched by the federal government? How do we look at all of the things that the federal government has done that has actually taken a swipe at Californians, like the state and local tax deduction, which I hope whatever tax conversation they have to restore for middle-income families here in California. It's looking at things like taking back some of the reins that we used to have in terms of our independent audits of programs. Medi-Cal, by the way, is now done through a single agency audit, which means that the agency that is actually administering the program, Department of Healthcare Services, is doing the audits, not the independent auditor like the state controller's office back decades ago. And there used to always be a certain element of waste in Medi-Cal. It's a big program. There's inherent waste. And back when we were able to audit that, certainly before my term as controller, we saw waste really in the hundreds of millions of dollars. And so there's real money there. And so I hope this is also going to be about how we can do our job in terms of being the most efficient as possible, having those guardrails in terms of being sure that our Californians are being served and that we're rooting out that waste, but also at the same time paying attention to where we need to build our own budget resilience so that we are not going to have to go through rounds and rounds of this every time there are federal policy changes.
That's actually a fantastic recommendation there, because you're right. It's time for us, when we start talking about Trump proofing the state, is also in regards to our budget, right? Not just in terms of our policies. Now, I believe that also there are some things that we've done, and we have to be honest with ourselves. The way California is wired, when people say that California is the fourth largest economy in the world, I say, to me, that's a red flag. Why is it a red flag? Because that means as our economic growth is expanding, so is suffering expanding, which means that our system is not working for the people who need it to. So that means we need to take an honest look at who are we making sure how are we making sure that the people who are working in survival mode every day, that the system is designed to work for them, not the people who are creating this historic income inequality that we have here in California. So yes, we're talking about eliminating the water's edge tax loophole, which basically means if you are a multinational corporation but you're not based in California, we won't tax you to a certain extent. But we're saying, well, no, if you do business in California and you're making money in California, it's time for you not to get that tax break anymore. It's time for you to make sure that you're helping to contribute to the success of California. And most of those corporations actually helped create this nightmare in the first place, if you look at their political contributions. And so it's time for them to feel the pain like the rest of us.
Thank you. Michael and Robin, I want to ask you about the impact of, you spoke a bit about direct cuts. I want to ask you about the impact of the indirect impact of cuts. So for example, if the federal government's cutting SNAP, CalFresh and California benefits, or cutting school lunch funding, or cutting, pending cuts to Medi-Cal, or the impact of deportations on mixed status families. So those cuts impact people who come to our agencies for services. So how do those kinds of cuts, which aren't directly funding your services, but clearly impact the world in which you're operating, how will those be impacting your organizations, and how will you be responding? I want to ask Robin if you can start us off on that.
Sure. What you're getting at is that our job isn't to deliver programs. Our job is to partner with people. And people are whole people. And in order for us to make an impact in partnering with them for the goals they have in their lives, we have to see them as whole people and understand the context in which all of us are living. So, we apply the common framework of the social determinants of health, this idea that there are key components of any individual or any family's life, that all of them factor into quality of life, stability, and well-being. And what we're talking about this morning is the already in effect or about to happen dramatic changes and shifts at a seismic level for almost every one of those areas of an individual's or family's quality of life and well-being. So we start by recognizing who calls us and who walks in our door and learning about who they are as individuals and people. Because although the federal government decided to stop the work of refugee admissions, our clients are still our clients. And those who we resettled in the past who are waiting for their family members to arrive, they call us, right? So we have to be ready for them. In our case, because we had such a large stake in welcoming newcomers to the East Bay and continuing to support them, when we saw that work stop, it had an effect not just on those direct programs and services, but on our core operations as well, because they're such a large part of who we are and what we do. And so we know that as we move through these next stages, we can only do that by not acting alone, but by continuing to invest in and grow our partnerships with community-based organizations, with government and public agencies at all levels, and also build new relationships with the private sector, with any willing partner, and to also bring these voices and experiences of our clients at a much higher level. But we can't look at all of the changes in a fragmented way. We have to start with the holistic approach to the individuals and look at all of the pieces and work on that together.
Thank you, Robin. Michael?
Yeah, I would just add, I was thinking that during COVID, folks were struggling. But there was resources, right? There were resources from the federal government. We had, like many agencies, we had long lines of people waiting for food, and there were dollars and there were resources, and we actually hired more staff to provide more services. What's interesting about the period that we're in now and going forward is that the needs are going to continue to get greater, right? Clearly, inflation is going in one direction. The needs are getting greater. More and more families are being impacted, and dramatically less resources. And so, but that won't mean that folks won't stop calling us. They will continue to call us and continue to look for services. And so we really do need to think of new models of providing services, of finding support, of gathering resources. The challenges are really, they're in every area. Robin, we've been talking a lot about refugees and immigrants, but really it's, we're hearing from the food banks that we're working with that they are seeing less federal funding, which means that we're going to eventually see less fresh produce. Farmers are not going to be able to get reimbursed for their crops. And so we know that in almost every area of the agency, there will be dramatic impact of the changes that are happening. And then just on a daily level, so most of us in California serve a fair number of folks that are non-citizens, that are undocumented. Many live in mixed status households. And so the question that we as operators of running social service agencies, are we actually supporting illegal immigration? We had a contract with FEMA, and in the letter that we got from FEMA, it was suggesting that the work that we were doing was criminal. And so the question is by providing financial aid to individuals from Haiti or from Cuba, whose status has been now canceled as their humanitarian parole, is that actually aiding illegal immigration? And so there's real questions about our staff are saying, should I be doing this? Should I be providing these services? Because they don't want to, somebody knocking on their door saying, hey, we see what you've been doing. And so just the environment that we're dealing with in terms of the uncertainty, and then on a really human level, the intersection between undocumented homelessness. I was chatting with an individual in our neighborhood the other day. He was telling me that he spends the majority of his time hanging out in Balboa Park. And why he does that is because he believes that that's the only place that he can be safe, that he's afraid even to go to the 7-Eleven. Because he's concerned that somebody will notice that he's undocumented or ask him for identification that he doesn't have. And so that level of fear, coupled with the financial impact, coupled with the uncertainty from the government, you can understand why retirement seems like a really, no, sorry. I had to do that.
You timed it perfectly.
Retirement
seems
like the
did.
perfect
really
plan,
did.
right? Okay, sorry.
Eli, if I could just add
Your
one
mic-
more.
Is your mic on? Okay.
Yeah, if I could just add one more piece to that. There's so much we can talk about this morning, but our Assemblymember really focused on the outsized impact of these cuts on older adults and young children. And young children typically are in families, and we are really seeing that as well. And for the immigrants and refugees and newcomers in our community, those folks have had incredible duress in their lives, and they've built resilience, and they come at all ages and multi-generational families, and they come with an opportunity in front of them to restart their lives. Every day, I start my day thinking about the older adults that we serve in our community and communities throughout our state and our country, because those folks don't have an upward economic future to look forward to. And for older adults who are on a fixed income, who are concerned about their health and their safety and their security, public partnerships and public services are what keep them living their lives in the ways that they want. And they don't have the scope of other options and opportunities that so many people in our state do. We're not going to find an easy answer to these solutions if we just keep working the way we've been working and hope something works out. This, I think, is our state's greatest challenge, is our aging population and our aging services and caring for our elders.
Robin, thank you, and that's a great setup for my next question, which is, it seems the rules of the game are changing in Washington, and are we playing with an outdated playbook? Are there things that we should be doing differently? I think you mentioned some things there, but please share your thoughts. I'm going to start and go down. Let's start with you, Ms. Yee.
Sure. Absolutely, we should be changing our playbook. First and foremost, just all of you being here and just expanding the voices of concern is really important. I don't think it's just left to your professional advocates anymore, but it is so cross-cutting in terms of what the impacts are going to be that to really do justice to what people are going to be experiencing. Certainly, your presence here really speaks to being sure that our elected officials are, one, supported in the work that they do, but two, really understand the enormity of the impacts that are going to be hitting us. I think one of the rules of the game that we can change, and I mentioned this earlier, and that is continue to build in terms of reducing our dependency on federal funds. We're big enough here in California to be able to start that journey. We're big enough in terms of our heart for innovation, in terms of how we look at growing our economy. And I think we can do it in a way where, as with every issue that we talk about, whether it's housing, whether it's aging, whether it's all the public safety, that we are talking about how we build this financial independence, fiscal independence from the federal government in all of the work that we do in terms of how we deal with our housing needs, our needs for our older population, by really backing up and talking about how do we collectively talk about building economically sustainable communities. We talk about housing a lot, but I always question housing to what end? And it's personal for me. I have a 102-year-old mother who still lives in the house where I grew up, and I'm happy that she's one of the few who can age in place, but so many who want to do that can't, and in fact are so far away from even attaining that hope. And so, but as we think about just smarter decisions about how we build for the long term, how we build for how we generate economies, I see actually a thriving economy around our older adult population in terms of a sector that actually is the care sector. There are a lot of needs in terms of how we're going to deal with a thriving older population here in California that we can actually begin to look at entrepreneurship opportunities. We can look